Hey everyone, I'm back with what is now my 6-month post-op update for my ACL surgery. For anybody who doesn't know, actually a long time ago, back at the end of 2019, towards the end, or at the beginning of November anyway, of 2019, I had a Judo accident that at least largely, if not completely, ruptured my ACL, and then I had a couple smaller little incidents that, if it wasn't completely torn before, finished it off. And so I was walking around for about 10 months on a torn ACL and recovered as much as I could, but obviously the knee's not going to be the same. At least it wasn't for me. I'm not one of those people who can function nearly at full capacity without intact ligaments, go figure. So I got the surgery back in September, on September 4th of last year. So just 2 days ago I hit the 6-month mark, if you're going by the date and not the number of days in each month, since I'm recording this right now on March the 6th. So I'm almost on time. Yay. But as far as how things are going, I'll start off here. Now it's probably going to look like this pretty much permanently, but the scar itself is completely flattened down as far as I can tell. There's still numbness here, but I've basically gotten used to it at this point. And it seems like from month to month a tiny bit of sensation is starting to creep back in from the edges, but I don't know if I'm going to get full sensation back. What I do know is that from a motor control standpoint, I think my control is fine. It's mostly just a sensation thing, this kind of weird dull numbness kind of thing. It seems to stop at about the middle or just past the middle of my kneecap. So everything outside here, right where I'm rubbing right now, is numb. The numbness comes down to about right here. So it's really close to where the incision is as far as how far down it goes. I know you can't necessarily see because of the light, but the incision actually comes down all the way to here. And so anyway, there's some nerve damage or something from that. As far as my mechanical function goes, well, I recently, just this past Monday actually, got examined by my surgeon. He says everything looks good. The strength seems fine, the stability seems fine. He's fine with just having me continue with PT as I can and continue with kind of exploring the workouts that I'm doing and all of the stuff I've been doing at home. I am doing weightlifting sessions. I've started doing some squats, mostly like goblet squats, body weight stuff, some hip hinge exercises to kind of keep getting my left hip to catch up to what my right can do. Been doing some lunges and movements where I step laterally. I don't want to say it's a frontal plane thing. I don't want to get into the mechanics and the misconceptions there. But basically, I am doing stuff where I'm stepping forward and back, I'm squatting up and down, I'm starting to step side to side. My pivots have improved some more since the last video. They're continuing to get better, mostly in the context of just being able to walk fast and go places and like turn a corner and not have to worry about blowing my knee out. Just doing my job. Speaking of which, this past week I did return to my office job. I don't talk about that on this channel really because it just doesn't have anything to do with the stuff that I've discussed on this channel. But in the future at some point I might talk more about that. Point is, I'm functioning fine. Getting up and down stairs, no problem. I recently had a bit of a milestone in that I was able to lower myself with my left leg, my operative leg, pretty much as smoothly and slowly as I can with my right when going downstairs. That's actually a big deal. I've had a lot of trouble with that. As far as my capabilities, I don't know that you'll see a whole lot of difference compared to last time, but if you're curious, pull these up a little bit so you can see the quads. My left quad is still smaller than my right, and is going to be probably for a long time, but here's the right, and you can pretty easily see there's still some quad separation there between the medialis and lateralis. I know the natural light coming in is kind of hitting me flat, and so it's washing some of it out, but you can probably still see some of that. My left quad, you can see, is smaller. I've started getting more engagement with this medial quad, the vastus medialis and the VMO area, I guess you would say. That was really hard to get. It still doesn't lock as hard as my right one does, but you'll notice I've lost a lot of size on the outside of the quad there. So there's a sort of quad sweep, I guess, a little bit, but I have more size out here. Obviously there's a difference. So I'm still working on that. But practically speaking, again, like I was saying, I can walk around and I can pivot and do all kinds of stuff here. No big deal. Basically, I still know that I had knee surgery. It's not 100%, but for all intents and purposes, I'm getting through the day without a whole lot of problem. I'm able to go grocery shopping and do chores. At my office job, I'm on my feet a lot, and the first day my knee kind of stiffened up a little bit, but it's adapted, and so there's nothing beyond a dull ache there. I can walk normally here. I can actually start moving backwards. We did some more ladder drills in PT since the last video. Box jump kind of stuff. We're doing things now where I'm hopping down off of a box and then jumping side to side. There's not a whole lot acrobatically that I can do in here, and I don't have a box really that's appropriate for me to step down or jump down off of to show you, but my function's pretty good. And I've gotten to the point now where I can almost, it's not snapping super fast, but I'm not having to be quite as careful about throwing the kick and then putting on the brakes before I get fully extended, so I can have a faster kick now. It looks at least like something. I can demonstrate it if I'm teaching somebody how to kick. I can pivot on this left knee without too much trouble. My right leg obviously still snaps faster, because I don't have to worry about the passive structures being exposed to too much force when I just snap the knee out. I'm doing all this cold right now, so my hips actually hurt just from doing that. So I have to work on that. But I'm doing a lot of very basic kick drills, the kind of stuff I would actually teach like a white belt to do and have lower ranks doing to practice their control. I'm revisiting a lot of that stuff. So I'm just kind of holding here, and that's part of the progress. It took me forever to be able to do that, right? So things are getting better as far as using it as a kicking leg. The other side, obviously when I'm standing on this leg, it's a little trickier, and I still have to be careful about pitching my hips too far, but I am getting better with using it as a base leg. So progress continues. So that's basically where we are. I'm going to do another follow-up with my surgeon in about 3 months, hit about the 3-month mark. That's the plan anyway. Things are kind of up in the air because I might be moving soon, and I don't know all the details just yet, but I'm going to continue to advance the exercises. I'm getting stronger with basically everything I'm doing. It took a really long time to get above more than like 30 or 40 pounds on my hamstring curls, the leg curls, and on the leg extensions. Basically, I was stuck with about a third of the weight I used to be able to do on those exercises with the particular machines that I'm using. Maybe I'll put videos together of those. I'm not sure. I don't know that there's a lot of interest in it, but those weights are starting to go up now that the knee can handle force without hurting so much. I'm able to put more effort in, because sometimes it seems like when you're experiencing a lot of pain, it might inhibit the muscle's abilities actually to contract as hard as you want them to. There's some kind of messy science with that, but I feel like it's getting better. I guess that's what I'm trying to say. The numbers keep going up with the weight that I'm able to move. The technique or the form I'm able to use feels a lot smoother as I'm doing it as well, so I feel like I'm getting more and more in control of the knee all the time. And I haven't formally started jogging, but I do jog a bit just from point to point. Like if I'm just in a hurry to get somewhere, I can do it and it's not excruciating. So it's kind of working its way naturally in. I don't have a structured jogging program because I technically didn't get cleared to. I did a Y-balance test, which I don't have the apparatus for, but you can look it up easily enough. There are videos on YouTube of a Y-balance test or Y-balance evaluation, where basically you stand on one leg and then you kind of squat down and use your other leg to kind of push a stick out or make a mark in 3 different directions: forward, back to your right, back to your left. And then you switch sides and do the same thing standing on the other foot, and use of course the opposite leg to push out or to mark these distances. And if your reach is similar on both sides, you pass the test, so to speak. I didn't quite pass it, I think a couple of months ago when they tested me, and they were supposed to retest, they never did. And that was going to be the thing, kind of the gatekeeper, as far as whether or not I'm allowed to run again. So we'll see. If I do go out and do that, I have my functional brace. It's still with me. It's just sitting in the other room that I'm going to strap down on my knee. A good sign, by the way, is that I am having to loosen up some of the straps on it, which suggests to me that I'm starting slowly to regain some muscle in my leg. At least I hope so. And so that's just going to keep going. I'm going to keep progressing the weights, keep progressing the load, respecting when my knee tells me to chill out, trying not to get too crazy and acrobatic with things, but just let things kind of return naturally, not rush the process. I'm suspecting that I'll be able to return to something resembling martial arts with partners in a few months. 9 months is often about when they do the return to sport thing where they kind of cut you loose, assuming you've progressed at the pace that they want. But we'll see. We'll see if that visit even happens, because I'm actually going to be moving. Speaking of moving, one final remark for anybody who's watched this long, I guess you deserve to know. As of this recording, I still live in Central Texas. I'm based in Austin, have been for about 6 years, a little over 6 years. But I'm going to be moving for school. I'll maybe give updates on that in the future, in a future video. But I'm going to be moving, and depending on exactly how that timeline works out, that might affect my care and a bunch of other things. So eventually this background is going to change as I move to a different place, and I'll be in a completely different state. So we'll see how that all works out. I did recently return to a job, and that's going to last for some period of time, and then I'm going to move after that. So the timeline is kind of not settled yet, so that's why I'm not going into details. But that may interfere with exactly how the care and the recovery thing happens, and where I even end up training when I go back to Judo and other things. So we'll see how it goes. But that's enough information now. I've rambled long enough. That's the 6-month update. Basically, I'm back to normal for all practical purposes when it comes to basic, normal day-to-day stuff, aside from like deep squatting still kind of hurts, and if I drop down and kneel on this knee, that's kind of painful, but it's more just an inconvenience than anything big. The big, explosive, sporty stuff, obviously, I'm not ready for yet, but in the coming months, I'll start exploring pieces of that a little bit more, and we'll see how that all looks. I do look forward to being able to do more videos in the future. The next stuff that you're going to see from me probably will be stuff like, I have a couple of reaction videos I've been wanting to do for weeks and weeks now. I got messed up with the freeze in Texas. That's another point that's relevant as far as why the previous video was so badly delayed. It was already late, and then it was made even later when I lost water for 10 days here. So things got a little crazy. Priorities had to shift. But I look forward to doing some reaction videos on fight scenes. I'll be doing some more stuff that involves demonstration of basic martial arts technique down the road as I recover enough to be able to show that stuff, to show off my mediocre skills, and help some people out. And we'll kind of go from there. So if you've watched this long, thank you so much. Give me some suggestions on stuff that you want to see, videos you'd like me to react to, other questions you might have about my rehabilitation or my recovery, the surgery, anything else, please let me know. I'm more than happy to answer anything that you might have, if it's something I can answer and it's something that's appropriate. So thanks for watching, and I will see you all next time. Cheers.